So I remember in college, so I went to Xavier University of Louisiana, and one of my microbiology instructors had a brief segment in his presentation about other fields outside of medicine. So, if you know anything about Xavier University of Louisiana, their primary focus is placing African Americans into medical school. But they understood that there are other important fields that are available. And this particular professor shared a brief introduction into epidemiology. And it really piqued my interest. So I was like, okay, let's just keep that in the back burner and see if that's something that I would be interested in. His focus was mainly on public health. So I thought, not really interested in doing that piece of it, but maybe there's something down the line that I can maybe look into. And so when I graduated from college with my degree in microbiology, and then I started finding my passion was always laboratory medicine. I was like, okay, that's what I know that I want to do. And we'll see where we go from there. And molecular microbiology, I fell in love with and started doing work around that in various firms. Now, when I transitioned from doing research development for pharmaceutical companies, I moved into the clinical world and I knew that I was getting closer to my calling. I started doing infectious disease laboratory testing on the molecular side. So HPV is doing all HIV genotyping, HCV, all those sorts of platforms, and immediately thought, okay, I'm getting closer. I know this is going to be for me, but there's something more that I want from this work. Yes, I love the infectious disease component of this, but there has to be something else where that would bring me closer to the patient. And so when I transitioned away from a reference laboratory and I worked in a standalone, a freestanding children's hospital in Texas, we ramped up quickly a molecular diagnostics laboratory. And one of the first platforms that we started was DNA fingerprinting. Lo and behold, our primary customer was the infection prevention department. And so when I started doing this work and in the laboratory, I'm like, oh my gosh, these samples are identical, indistinguishable. Where does it go from here? And I connected with the infection prevention team to understand what happens after we give them these results. And when I met with that team, I knew then, I was like, this is exactly what I want to do. And so I asked more questions and absorbed everything that I could about infection prevention. And at that time, now this is 2008, this is at a time where nurses dominated this field. And so when I had my conversations with those individuals, they were just like, well, you might have to go to nursing school to be able to transition. I'm just like, nope, I'm gonna prove them wrong. I'm gonna figure out a way that I'm gonna break into this field. And so I started looking around. Many of the job descriptions required 5 years of clinical experience. If you're working in a laboratory, that would count, but they wanted 5 years. And so I worked the day of my 5th year anniversary in the laboratory is the day I transitioned to infection prevention. So I always knew that this was something that I wanted to do as soon as I got into that exposure to the department.